Thank you for joining us. I'm here now with Dr. Timothy Pluard with the St. Luke's Koontz Center for Advanced Breast Cancer. And you recently just went to the ASCO conference of 2019 in Chicago. Lots of exciting news there for patients of advanced breast cancer. First, tell me about the updates we learned about ER-positive breast cancer.
Well, there were several exciting ER-positive presentations. Probably the most exciting was the Mona Lisa 7 clinical trial results, which was a study looking at in premenopausal women who are ER-positive, utilizing ovarian suppression to reduce their estrogen production, along with an aromatase inhibitor with or without ribociclib, which is an approved CDK4/6 inhibitor that's used in the clinic. But in this study, they showed actually a rather dramatic improvement in survival. So at 3.5 years, the group getting ribociclib, 70% were still alive compared to 46% of the patients who were receiving placebo or just anti-estrogen therapy. So we know that these drugs are very effective, but this is really the first evidence that we have of a significant improvement in overall survival.
So what is the Koontz Center here doing for patients with ER-positive? What's our newest treatment options?
Well, certainly we are sequencing everyone with metastatic breast cancer, particularly the ER-positive patients, to know if they carry the PI3 kinase mutation, which would make them eligible for alpelisib. We also have multiple other clinical trials that we're looking at with new anti-estrogen agents, including a new class of anti-estrogen drugs called SERCAs. And we have just recently opened a study with one of those drugs for patients who have progressed following their first anti-estrogen therapy.
Another common form of breast cancer is the triple-negative breast cancer. Tell me what news came out of the conference as far as that goes.
So we had an update of the recent Impassion 130 trial, which looked at combining immunotherapy with Abraxane in first-line metastatic triple-negative breast cancer, which showed an improvement in overall survival. The survival was updated, and it still shows a consistent benefit for Tecentriq and Abraxane in first-line therapy for metastatic breast cancer, which is PD-L1 positive. Only about 40% of patients are PD-L1 positive, and that biomarker is important because it has to be present in order for that therapy to be effective.
Okay. And then third, tell me what the update was for HER2-positive breast cancer.
We saw a couple of interesting studies regards HER2-positive breast cancer. Margetuximab, which is a enhanced Herceptin that was engineered to be more effective at stimulating the body's immune system to recognize the HER2 targeted cell and destroy it. And we all have different alleles on this various immune marker. And they showed that in those patients who had a specific variant of this, which is the majority of the population, actually had a better outcome when treated with margetuximab versus Herceptin when combined with chemotherapy. So further studies are needed, and hopefully we can identify those patients who will truly benefit from having that drug versus Herceptin.
Okay, so lots of exciting advancements in research and treatment. What's the big takeaway that Koontz Center patients can take from this conference?
So we're seeing actually movement, I think, in all three subtypes of breast cancer, the ER positive, the HER2 positive, as well as triple negative. So we're seeing progress and new drugs coming to the clinic for patients with metastatic breast cancer to improve their outcomes.
Thank you, Dr. Pluard. And for more information, you can visit our website, stlukeskc.org. You can also visit our Facebook page, St. Luke's Koontz Center for Advanced Breast Cancer, for all the latest news and updates of metastatic breast cancer.